Hey guys, hope everyone's doing well. It has been a while since I made a video. It's been like 2.5 months because I was really busy and I had to get a a new laptop um, and stuff. But I wanted to make this video mainly talking about um, mainly talking about mainly talking about um, therapy and techniques. This won't be a video about how to how to how to how to how to use techniques, but just talking in general about them I I because because I am aware that there are some people who feel like tech, techniques are not useful um, outside of outside of therapy sessions, and they don't transfer well to real life, um, which is what um, which is what makes some people want to um, pull away from the idea of speech therapy, or they believe that they had it and it didn't work because they couldn't transfer the skills into real life, which um, I hate that, and I find that it's very unfortunate for people who have that experience, because with therapy, with with any kind of with any kind of therapy, that is the ultimate goal for it to transfer into real life. And so I just wanted to say, it's not that the techniques, well, yes, there are some techniques that don't transfer well, because I have, I have um, known therapists who try to teach children who 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 stutter to use robotic speech. So that definitely doesn't transfer well. It could transfer well because you could do it in real life, but then who really wants to talk like that and draw more uh, 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 attention to themselves? So if you are looking for a speech therapist to work with you or your child, it's just very good to know um, what does sound like it could transfer in real life, but also what is the child comfortable doing. When I worked as a speech therapist assistant, and I had a kid who stuttered, I knew of a bunch of different techniques. So I would show the kid maybe like 2 techniques a week, say, and we would work on those. And then I would say maybe a week or two later, okay, which ones do you feel comfortable with? And he had some things that he liked, and we would continue to work on those. And then he told me which ones he didn't like, and then I wouldn't bother with it again, because it was all about him. And that's the that's the that's the experience that I had when I did speech therapy. They didn't ask me which ones I liked, but they used ones that did transfer over. And I think also because of my age, since I was um, in speech therapy as young as 4 years old, It was a lot easier for me to, I guess, apply that. And I wanted to um, impress, for lack of better words, impress the 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 speech therapist, and my mom, to let them know that I was doing what they told me to. And so now, typically in real life, I don't use techniques that that much, simply because for me, I became too 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 obsessed with them. So for me, um, it was like a it was like an 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 all or nothing thing. And it was, I just got to the point where I was like, okay, I have to use them, or else I don't, or else I don't speak well. Um, so I try to steer away from it as much as possible. Um, and even when I was doing job interviews and stuff now, I would I would consciously try to tell myself to do voluntary stuttering, even when I knew I was having a pretty fluent day, just because I didn't want to get caught up in, or obsessing about being covert again. So personally, what my therapist did for me was pausing and slow rate of speech. And like I said, for me, that really helped. So I wanted to show, um, for me, what the difference sounds like. So I have something that I'm going to read here. Um, and the first time when I read it, I am going to do it without any um, techniques or any alterations, and then I'll go again to show how I would do it, with techniques, when I was, being covert and had to read and in in high school, and in college, because I wasn't letting people know that I stuttered then. And I have to put my glasses on because I am like blind. Okay, so this is without techniques, as you'll be able to hear. Welcome to the National Stuttering Association. The National Stuttering Association is a nonprofit organization dedicated to bringing hope and empowerment to children and adults who stutter, their families, and professionals through support, education, advocacy, and research. If you are a person who stutters or have a special interest in stuttering, you are welcome here. For the time we meet here, this room is a very special place. It is a place where we are accepted and supported. It is a place where we can relax and speak freely. It is a place where we can stutter openly without fear and embarrassment. It, it is a place where we can practice whatever speaking and communicating techniques with which we may feel comfortable. Together we will help each other and we will help ourselves to accept and cope with our stuttering, to build our, our self-confidence, and to improve our verbal communication skills to the best of our abilities. We who stutter and those who support and help us are not alone. Together we are strong. Okay, and this is how I would read using techniques of slower rate of speech, pausing, possibly slower rate of speech and um, pausing. Welcome to the National Stuttering Association. The National Stuttering Association is a nonprofit organization dedicated to bringing hope and empowerment to children and adults who stutter, their family and professionals through support, education, advocacy, and research. If you are a person who stutters or have a special interest in stuttering, you are welcome here. For the time we meet here, this room is a very special place. It is a place where we are accepted and supported. It is a place where we can relax and speak freely. It is a place where we can stutter openly without fear and embarrassment. It is a place where we can practice whatever speaking and communicating techniques with which we may feel comfortable. Together we will help each other and we will help ourselves to accept and cope with our stuttering, to build our self-confidence, and to improve our verbal communication skills to the best of our abilities. We who stutter and those who support and help us are not alone. Together we are strong. See? Um, so that's how it goes. And like I said, that is what 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 I learned that works for me, and it sounded um, very, 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 very natural, without too much change, and it's not, once you continue to work on that, it becomes something um, that you almost don't have to force yourself have to force yourself um, to think about. It just can become like a secondary behavior. But 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 in spite of that, I do still feel like you know uh, self acceptance comes first, because um, the bottom line is techniques don't always work, so you still have to um, take an 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 emotional um, approach as 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 excuse me. You still have to take an emotional approach as well. So that is all I wanted to say, and I hope everyone enjoyed this. Bye.